Hello, this is Dr. Robert Bouvier with Dr. and you were sent here to this video to learn a little bit more about telemedicine and mobile health. We'll call it mobile integrated health. So why would we want to do this? Well, actually, patients came to me and wanted to learn a little bit more about how they can get their services in the home. This was years and years ago. Businesses, employers, actually we've been working with them for the last 25 years to bring actually health-related items to the self-employed, the self-insured employers, hospital administrators, insurance companies, and even businessmen who travel a lot overseas have asked me to do this video and explain a little bit from their different perspectives as to why telemedicine and mobile health. So let's get into it. The bigger picture with telemedicine and mobile health is basically to take those services that people would normally travel to, take a day off or half a day off, and travel somewhere to get those services done. Now those services are being brought to the work site, to the workplace, to the home, when you travel, basically following you wherever you might go. Let me give you an example of that. 25 years ago, we set up an intensive care unit, basically in a person's house, and we had 24-hour nursing, IV therapy. Basically, it was an intensive care unit, a heart monitor. Hired one of the paramedics to actually watch the monitor and sit with them overnight. Nurses during the day, ICU nurses during the day. So we were able to bring that at a cost, obviously, to somebody's home, but it was mobile, and we had telephonic ways to get the information to us using one of the ambulance services at the time. It's a very progressive ambulance service, and we used their technology to actually keep things monitored and keep me in connection with. I actually took one of the radios. Didn't have cell phones back then. Actually, cell phones were just kind of starting to make sense, and it was the old bag phone. Before that, 200 years ago, mobile health was the little doctor in their black bag and the public health nurse going out to the homes and businesses and seeing people. 30 to 50 years ago, it's the home health care agency taking care of sick patients in the home with their OT, occupational therapy, physical therapy, speech, social work, sometimes a psych nurse going out, and that has worked out very good. Nowadays, there's new kids on the block that we're going to get to in a minute, but there's new technology and new kids on the block to help us actually help people stay at home even more than what we could before. Because now the goal for patients are, number one, keep people out of the hospital and emergency department, and number two, delay the onset of stroke, heart attack, and cancer for as long as you can. In our office, we say 30 to 40 years. So how does that all work? How do we use that? How do we use the technology the way it was intended? I call it UTI, not urinary tract infection, but using technology the way it was intended. We can now use smartphones that have Skype and FaceTime on them. We can also text back and forth. It keeps us well communicated in a real-time fashion. Really, before cell phones, it was very cumbersome to be able to keep connected. And all this is actually a free service that we can actually keep connected with patients now. The years of proprietary, costly softwares to do this are really a thing of the past. So telemedicine and mobile health has really come into its own, and over the last 10 years it's just taken the country by storm. And as a consumer, you can expect to see more and more of that. So from a patient's perspective, we can use this new technology. They can travel to different areas of the country and even areas of the world and bring their health with them. One of the techniques that we use in mobile health is the medical kit. And if you go to the website Dr. and you'll be able to learn a little bit more about that. The kit is one thing. The other is the book, which is a personal health record that travels with the patient, either in a paper form as a 3-ring binder, or we use Dropbox in the electrical form, which is also a secure, free service that tends to really work well when patients need the information, need it real time. You can go again to the website Dr. and You, and click on on that information and learn a little bit more about the book. Other pieces that we've connected for patients is similar to what we use for businesses, and we'll get into that here in a minute. So for the employer, the employer situation is a little bit different. The employers have had a situation where it's become very expensive for them to offer a quality healthcare benefit. Actually, if employers will transition from traditional, what you would think traditional insurance, to a high deductible health plan, health savings account, and flexible spending accounts, you can usually save money, significant money. I can give you examples of that if you give us a call on how to take care of that. There's also videos on the website to explain how to save money as an employer. So I'd encourage you, where it says businesses only on the top bar, I would go click on that and look at the videos there as well. But in general, we can improve that healthcare benefit that your employees are looking for, and it will not break the bank for Mr. Employer. For hospital administrators, using telemedicine and mobile health is the key to the readmission problem. The readmit rate is crazy across the United States, and now you're getting fined for it. So mobile health telemedicine is able to take care of that. One of the things that we found using smartphones, we'll take the patient's smartphone or the caretaker's smartphone at discharge, and we'll videotape what we want the patient to do, because when the patient leaves, the caretaker nor the patient will remember anything the discharge nurse says. Also, we use the medication reconciliation sheets that we find in the book and the kit in different areas of telemedicine, mobile health, to help make sure there's no medication errors. On the website, there's also information about that, how you can use using technology the way it was intended to help with that readmit rate. There's a lot of other little techniques that we use in mobile health with at Dr. and You to help the hospital administrator decrease that readmission to the hospital. For the traveling business person, you want to be secure to know that if you have an emergency traveling in Singapore, India, wherever, China, that you can get to healthcare fast. And with telemedicine and mobile health, you can do that. We've been able to communicate real time with patients 4 hours away from Singapore, different areas of India, China, and to get the health care that they need ASAP. Many times with this little thing that we call the medicine kit, or the personal medical kit that they travel with, we can even have a portable EKG that's attached to their iPhone to help with them. Quick blood tests even in this medical kit, and it comes in a bag no more than this size. 10 to 15 different medications, some of them IV, that we are there just to be just in case for the traveling business person. It's a very simple little soft case, and it's helped. I can give you numerous examples how it's helped people stay out of harm's way when they're traveling, both locally here in the States and also abroad. So mobile health and telemedicine is a very broad service, but basically it takes all those services that you would travel to, now can come to you as a generality. Obviously you can't bring an MRI to your doorstep, but we have had some businesses that have a mobile MRI come to them once a month. So to kind of wrap this all together, the conclusion here, we can help the businessman decrease their premium, improve the quality of healthcare benefit to their employees. To the individual patient, we can take those services that you would normally travel to get to, we can do it at home and help keep you out of the hospital and emergency department. For the hospital administrator, we can help you decrease your readmit rate significantly through telemedicine and mobile health, and same thing for the insurance company. If you have any questions, please give us a call at Dr. and You at 810-610-7972, 810-610-7972, or you can email me personally, Robert at robertbouvier.com, Robert at ROBERT, B as in boy, OU, V as in Victor, IER.com. Again, this is Robert Bouvier with Dr. and You, and we've been speaking a little bit about telemedicine and mobile health. Thank you.